Next up is Chris Barton. Chris is the Senior Director, Integrated Systems of Care and Network Innovation for Horizon Blue Cross Blue Shield of New Jersey. And Chris is going to talk about a topic that is too much present these days, youth mental health. Chris, the floor is all yours.
Thank you so much. I'm so thrilled to have the opportunity to talk with all of you today about the impact that our youth mental health crisis is having on the workplace. In the brief time that I have with you, I'm going to address 4 important concerns. First, I'm going to tell you a little bit about what youth mental health crisis means. Next, I'm going to tell you about how the youth mental health crisis is affecting New Jersey business and industry. Then I'm going to tell you what employers can do to support their employees and their families. And finally, I'm going to give you some information about how parents can help their kids who are struggling with mental health issues. So point number 1, what exactly do I mean by youth mental health crisis? The headline that takes my breath away is that suicide is the 2nd leading cause of death for children, adolescents, and young adults between the ages of 10 to 24. That means that children as young as 10 years old are dying by suicide. That just crushes a mom's heart, right? The only greater cause of death in this age group is accidents and injuries. According to a national study, more young people, especially young girls, have seriously considered suicide than ever before. In fact, 1 in 3 young girls have considered suicide. 1 in 4 have made a plan for suicide. And 1 in 9 have tried to end their life by suicide. Female students in grades 9 and 10 are most vulnerable to suicide thoughts and planning. And there are a number of risk factors that contribute to suicide among youth. For example, a child who has serious or complex psychiatric conditions is at higher risk for suicide. These may be psychiatric disorders like major depression disorder, bipolar disorder, and substance use or conduct disorders. Or there may be what we call co-occurring psychiatric conditions when there are more than one psychiatric conditions, any combination of mood disorders or destructive disorders or substance use on top of a mental health condition. All of those are considered risk factors for suicide. Then there's something called adverse childhood experiences, or ACEs. These are traumatic experiences that affect children at a deep emotional level. And they're things like physical and emotional or sexual abuse, household dysfunction, including mental illness or substance use in the home, intimate partner violence in the home, parents or family members who are incarcerated, or death or divorce of a parent. Those all have lasting, deep emotional impacts on children. There are also environmental influences that impact on youth mental health: food and housing insecurity, poverty and violence, feelings of social isolation and bullying. Family relationships and support networks also play an important role in youth mental health. The presence or the absence of healthy, supportive adults contribute to youth mental wellness. Find those people who can have a positive impact on your children and be sure to include them in your lives. And something that my colleague Tracy Paris Benjamin mentioned earlier, being a member of a marginalized population, a person of color, a member of the LGBTQ community, anyone who has experienced racism or bigotry, all of those contribute to higher risk factors for youth suicide. We tend to focus on risk of suicide, and that is certainly the most extreme example of mental health problems. But I think we also need to focus more on prevention and early intervention to avoid the risk of suicide altogether. Here's another alarming statistic. I know that we're all data focused this morning, but only about 50% of the children aged 6 to 17 who were diagnosed with mental health conditions actually receive treatment for their mental health condition. There are all kinds of reasons for this. I think many of us have covered this, including stigma, access to care, parental consent, and their availability to take a child to appointments. But just recognize that half of the children who need treatment for behavioral health are not receiving treatment. That in itself is a risk for suicide. Some of the most common mental health diagnoses among youth include attention deficit hyperactivity disorder, anxiety, behavioral health problems, and depression. And for those who experience depression, about 3/4 of them also have another psychiatric disorder, including anxiety or other behavioral problems. Many people attribute the decline in our children's mental health to the COVID-19 pandemic and the isolation, the grief and loss, and the anxiety that came with that. But the reality is, Our children's mental health has been declining for almost a decade now. Beginning in 2014, we saw early signs of increase in mental health concerns, thoughts of suicide, and attempts to die by suicide. Some people attribute this to the insidious nature or maybe the obsessive use and lack of regulation around social media. Others point the finger at bullying and social ills. Whatever the cause, the tide has certainly turned. Our young people are more depressed and more anxious than they have ever been in the past. And there's nothing right now to suggest that that's going to get any better anytime soon. So we need to be able to deal with the manifestation of youth mental health. So point number 2, how does youth mental health crisis affect New Jersey business and industry? I'm sure a few of you are wondering why I'm talking about youth mental health at the New Jersey Business and Industry Conference. Some of you may be employers of young people, so this may impact you directly. But even more of you may be the employers of parents of young people. And so this topic should resonate with you. A national study reported that 2 out of 5 employees, or 40% of our workforce, have a child under the age of 18. And depending on the industry, that statistic may vary. The health of children affects who cares for them, which in turn affects employee health and productivity. Said another way, if the kids are not all right, neither are their working caregivers. Over the past few years, more than 1 in 5 caregivers have voluntarily left their jobs to better care for their children's behavioral health needs. That says something. So how does the youth mental health crisis affect companies? Youth mental health concerns affect absenteeism. Missing work to stay home with an emotionally sick child in the same way that they would for physically sick children. Employees may miss work, they may leave early or arrive late due to behavioral health appointments. As many as 50% of working parents report missing at least 1 day of work per month due to child illness. Youth mental health impacts on productivity and creativity. The pressure of having a sick child, whether it's behavioral health or physical health conditions, impacts how much parents can be present in the workplace and how much they can contribute and interact with their peers. So that affects productivity and creativity. Youth mental health concerns also impact your company's healthcare expense. Untreated or undertreated mental health concerns, like physical health concerns, will get worse over time. They may even manifest in physical health problems that lead to physical health care needs. There are often emergency department visits and inpatient stays, all of which drive up the healthcare costs for employers and the cost of healthcare for parents. So the mental health of children definitely affects the mental health and productivity of parents and caregivers, which in turn affects New Jersey business and industries. The health of companies is inextricably tied to the health of families. So point number 3, how can employers support their employees and their families? Judy talked about some of the things that companies have done to improve the overall health and wellness of their workforce. Gym memberships and employee benefits. Many companies have pivoted and have expanded their benefits, increased their EAP offerings, developed those wellness programs and other resources to address their employees' mental health and wellness concerns. But what have companies done to help their employees cope with the stress and pressure of their children's mental health concerns? Supporting parents and caregivers who act in the role of parent is a critical public health priority. Sometimes it's our employees that need help getting the help that they need. And we've talked about this today, making sure that we have a comprehensive behavioral health benefit package, offering a robust employee assistance program, making sure that employees have access to what we call self-directed care, the ability to access education about conditions and resources that the family may need. Supporting employees in getting the help that their kids and their disabled adult children need, again, with a comprehensive behavioral health benefit. Employers should consider modifying the co-pays arrangement to improve access to care. Remember that for mental health conditions, appointments tend to be weekly or bi-weekly appointments. A $50 copay for a biannual physical health visit may be reasonable, but a $50 copay twice a week may not make that resource accessible for parents. Are there obstacles to your employees accessing the care that they and their kids need? We talked a little bit earlier about promoting work-life harmony. I stay away from the word balance because there's never really going to be a balance between home and life, but we have to find a way for the two to coexist. We talk about building generous parental leave programs or flexible work schedules that support parents in meeting their children's physical and behavioral health needs. That may mean taking them to physical health or behavioral health appointments, attending school meetings. Be sensitive to the fact that behavioral health symptoms often manifest in school-related concerns, grades problems, behavior problems, decision-making, and social relationships. Parents need to be able to partner with schools and educators to address these. And if an employer can give them the space to make that possible, they're going to be a more content employee and more loyal to the company. Encourage both parents to strive for work-life harmony. As employers, we tend to focus on mothers as the primary caregivers. And I have to tell you that this is outdated thinking. Fathers are equally important for promoting children's mental health. Raise awareness and address stigma about mental health, substance use, and other disabilities. Consider implementing employee relations group or affinity groups, and use these groups to advance messaging around education and reducing stigma about behavioral health conditions. May, for example, is Mental Health Awareness Month. Substance Use Recovery Month is in September. Use these opportunities of awareness events to normalize conversations about behavioral health concerns. And then support parents of dependent adults with physical and behavioral health disabilities. Many of these conditions are chronic, lifelong, and the parent continues to live in the caregiving role for that lifetime. Support employees and their families in celebrating successes while supporting ongoing care needs. And Michelle mentioned this earlier. When you ask somebody how they're doing, stop and listen for the answer. Encourage managers to schedule listening check-ins, not necessarily performance check-ins or work-related work, but check in with your employees, especially in a virtual work environment. Team members need to know that somebody cares about what's going on with them and that they're willing to set aside time for a personal check-in. And point number 4, how can parents help their kids who are struggling with mental health issues? The first, and this was just addressed by the previous speaker, addressing the generational and cultural stigma of denial of mental health problems is the best first start. So many of us have biases about mental health problems that we learn from our parents as parents and families that we carry with us. These prevent us from seeking care for ourselves and also for our children. Parental stigma is one of the main reasons that children do not have access to mental health treatment. Some of us just don't know how to recognize the signs and symptoms of mental health problems. Another speaker mentioned this. You can get training on how to recognize mental health problems from the Mental Health Association of New Jersey. They offer mental health first aid training and QPR training that can help you know when your young person is at risk. Some of the other things that parents can start doing right away: be present, actively listen, sit with your child and talk, preferably without electronics, at family meals, during evening downtime, and during car rides. Be open to learning. Parenting is tough. It doesn't come easy to all of us, and many of us didn't have great role models for parenting. There really isn't a great guidebook, so find some help in learning and growing as a parent. Everybody can improve their parenting skills. Take a class, talk to friends, do whatever it takes for you to learn and grow. If there are adverse childhood experiences in your home, address those. Things that can be emotionally toxic, like conflict that is transparent to the children, poor parent-child communication and relationships, untreated substance use disorders and mental health problems in the home, or openly aggressive or hostile behavior has to be addressed in order for the children to be okay. Build in protective factors that support children, close gaps in care needs, address food and housing insecurities. Your EAPs can help you with resources for this. And continue to be present. Develop the warm and supportive relationships that you desire with your children and that they desire with you. It's never too late. Seek help and support from family members, friends, neighbors, communities, churches that can help you and your child grow together. And focus on helping your child develop positive self-esteem, good coping skills, peer relationships, interest in and success in school, and just an ability to articulate your feelings. And I can't stress enough, if there are behavioral health concerns in your home, mental health or substance use disorder, get treatment for those. That's the best thing that you can do to support children in the home. Youth mental health is a huge issue. It's going to take some time to shift the tide, but if we all do things that are within our power to control, we can begin to make a difference. Thank you.
Thank you, Chris. Very, very sobering statistics, but a topic we have to pay attention to, and very, very emotional, and absolutely the impact that this has on a family, and then the impact that translates, of course, into the workforce. This is why we provide these resources. And a side note, sometimes we think about, you said the age of the girls, right? The average age, and teenagers, the challenge with teenagers then also is they kind of say, I don't need this. And how do you, a little kid, you put them in the car, you take them. When they get older, it gets a little more challenging, right? So nobody needs to be in this alone. There's so many resources out there. I can't encourage people enough. If you even have the slightest, sight that something isn't going right, talk to somebody about it. They'll talk you through how to make it work. None of us wants to be one of those statistics. And unfortunately, we just see too much of it. So thank you for sharing your expertise with us today. Let's keep in mind, the things that we should be looking for and how we can be helpful to each other on this. Thanks, Chris.